This is your trauma assessment station.
You are dispatched to the corner of Welch and Grand for a 20-year-old female found lying on the pavement with a head laceration.
Okay, so I walk up, my BSI is on, check to make sure that my scene is safe.
Scene is safe.
This is a trauma patient, which means there is a mechanism of injury. I'm looking around, making sure I have one patient, and my need for additional help, I might as well ask for it just in case I need crowd control. My general impression of the patient is of a 20-year-old female lying on the ground with a head laceration. So my level of consciousness I will determine by asking her 3 questions, person, place, and time. Hi ma'am, I'm Kate from EMS. How are you?
I'm good. How are you?
I'm good. Can you tell me your name?
Jesse.
Okay. Can you tell me where you're at?
I'm laying on the ground outside a bar.
Okay. Do you know which bar?
Sticks.
Okay, that's great. Do you know what time of day it is?
Sometime in the middle of the night, I think.
Okay. And do you know who's president?
I'm not sure.
Okay. So can you tell me what's going on with you today?
I was at the bar partying a little too hard and came out and must have missed my step and gave myself a good old smacking.
Okay. So chief complaint is the laceration to her head. So I'm going to open and assess her airway. So it looks open right now. Just check for adequate ventilation, adequate chest rise and fall, and I'm going to insert an airway adjunct as indicated, and it is not at this time. I'm going to check breathing, just assess the ventilations. I'm going to go ahead and put her on some O2, initiate that pretty early. Let's go with a non-rebreather at 10 liters per minute. And then I would manage any injuries associated with breathing, and it looks like there is not at this time. Circulatory, I'm going to just check her pulses just to make sure that they're present. Are they present?
Pulses are present.
Okay. Then I'm going to check her skin parameters.
Skin is pink, hot, and dry.
Okay, just look and see if there's any major bleeding that I need to control aside from this head laceration.
No bleeding noted.
Okay, and we're going to go ahead and treat for shock and just put a blanket on her just in case. I'm going to determine that this patient is a priority patient, a little bit altered mental status, head laceration, so we're going to go ahead and go and transport. So I'm going to start my sample history, so signs and symptoms, her skin parameters, and the sign for head laceration. Ma'am, do you have any allergies to anything?
Not that I'm aware of.
Okay. No drug allergies or seasonal allergies?
I have seasonal, but no drugs.
Okay. Are you on any medications including birth control?
Yep, I take birth control.
Okay. Have you been hospitalized for anything recently? Were you diagnosed with anything?
No.
Okay. What was the last thing you had to eat or drink today?
Some cheese balls and a couple of beers.
Okay. And just so I'm clear, you were just walking out of the bar when this happened, you just misstepped?
Yeah, I think I just missed the doorstep and smacked my face as I hit the cement.
Okay. So now I'm going to do my secondary assessment, or my rapid trauma assessment. I'm going to use my hands and do a blood sweep, just palpate her scalp with the palms of my hands, check for blood, check for tenderness, palpate behind the neck, check for JVD, check for tracheal deviation, and go ahead and put a C-collar on. I forgot at the beginning of my assessment to consider C-spine, and since it was a mechanism of injury, we're going to go ahead and put a C-collar in and do full spinal precautions. I'm going to use my pen light, look in both of her eyes, look in her ears for blood and cerebral spinal fluid, look in her nose. Can you open your mouth? Look in her mouth for blood, secretions of vomitus or teeth. We're going to palpate down her shoulders and onto her chest, over her sternum and across. Push in on her ribs. Do a belly roll. Just watch her face for a pain reaction. Check for rigidity or distension. Come down on her pelvis and push in and down. Check for instability. Then we're going to come down on her extremities. Just check my hands for blood. Okay. Then we're going to do PMS on all extremities, so her shoes would be removed. Check pedal pulses.
Present.
Pull up on my hands. Can you push down on my hands? What foot am I tapping?
Right.
Okay, what foot am I tapping? Left. Okay. And then we might as well do that up here. Come down and check left extremity, right extremity, check PMS, check pulses.
Present.
Can you squeeze my fingers? What hand am I touching? Left. What hand am I touching? Right. Okay. So now we would check her posterior. So we're gonna log roll her and put her on a backboard. I would have another person help me do that. Thanks. Check her thoracic, lumbar and sacral spine in the buttock area, and just palpate for depressions, contusions, abrasions, punctures, burns, tenderness, lacerations and swelling, and any discomfort. Okay, roll her on the backboard. Then we would check vitals. I want blood pressure, pulse, and respirations. And then I would manage any secondary wounds associated with her injuries, and I would reassess her every 5 minutes on the way to the hospital. And then I would do appropriate transfer of care to the receiving facility.
Is there anything you would have added, changed, or done differently?